So earlier on we said that periosteum inflammation, periosteum is like that outer covering of the bone. So if there's an inflammation of it, they call it what? The periostitis. Periostitis. So you can have the different types now. You can have the chronic periostitis, you can have the diffuse periostitis. So that's what we're actually trying to hammer on. So this is periostitis, alright, and this other one is a what? Osteitis, which is like inflammation of the whole bone tissue. But periostitis is just inflammation of the periosteum. So periostitis in general refers to what? Inflammation of the periosteum, which is like the connective tissue covering the bones. It's in different forms. So if you are talking about chronic periostitis and diffuse periostitis, is basically the forms that you're talking about. So chronic periostitis just simply means what? The inflammation has been there for a very long time. It's a long-standing inflammation, usually due to persistent infection. So the infection has been persistent, or trauma, or systemic disease. So causes: chronic infections, or repeated traumas or stress, autoimmune conditions, or all those metabolic imbalances. So features: you have a thick periosteum, there's pain and tenderness over the affected bone. Radiographs will show irregular periosteal reactions, and bone thickening is irregular. So cause is actually slow, often associated with what? A disease condition that is also progressing slowly. So over time, do you understand? Then for the diffuse one, it's just widespread inflammation of the periosteum. So it's affecting larger areas of the bone. So instead of on an X-ray, you can be pinpoint that okay, there's issues here. On a diffuse periostitis, you can't really pinpoint what that okay, the issue is only in this particular area. You understand? So causes is systemic infections, metabolic or systemic bone disorders. Is sometimes seen in inflammatory conditions spreading across multiple bones. Alright, so that's what we got. So features is generalized pain and swelling along the length of the bone. Radiographs will show diffuse periosteal thickening or layering. So it's often bilateral, could affect both sides. So it's more extensive than chronic localized periostitis. It's often linked towards systemic illnesses.